Hi, my name's Tawna Young, a nurse practitioner specializing in psychiatry, and today I'm going to teach you how to use CES on your patients with dementia. Of course, in all cases, there's the ear clips that come. A thing to remember about the ear clips is that it's this thick side that is sending the signal. This back side, that's just a lever to hold it on. See how the wire goes into that one? This is the one that's sending the signal. These are removable that way. Okay, and another thing to remember is that if you were to just put these on someone's ears dry, nothing's going to happen. It has to have some kind of fluid to conduct. They do come with a little dropper. You can use just plain water. You can use ultrasound gel, really any kind of fluid. I would not use distilled water. You do want it to have a little bit of electrolytes in there, so you could use tap water, or maybe put a little pinch of salt in there, but you do have to have it wet. You could put a little drop right on the ear, or sometimes I just drop it like that on there. Again, you need to make sure that it's this side. Both sides can come in contact with fluid, it doesn't matter, but this side absolutely has to or won't work. Doesn't matter if you go behind the earrings, in front of the earrings, doesn't matter, and it doesn't matter if you go this way or that way either. You want to make sure you use both, because if you don't, again, one side sends it, one side receives it. It is important that it goes through the brain, both sides. If some people prefer to use these little pre-gelled electrode pads instead of the ear clips, that's fine. For most people, the ear clips are going to be the best bet, but if some people prefer these pads, that's fine. If you do use these, you want to put them on that bony part right behind the ear, right in there. Not down here, not here, right up there, not on the temples either. These, like I said, they're pre-gelled, so you don't have to use any water on them. However, the adhesion part does kind of wear out over time, so it'd be easy with an elderly individual to maybe not notice that it's come off. So for most people, the ear clips are going to be the best bet, but these are fine too. Now, when it comes to knowing how high to turn it up, if we're talking about someone who isn't going to be able to verbally communicate what they prefer, typically I'll recommend that you turn it on. Let me turn it this way. Pretty much at the end of that blue is where people are going to start to feel it. Now, it'll go all the way around there until it maxes out, but most people are going to start to feel it right there. So that's about, if someone isn't able to tell you what level they prefer, I'd say put it around there. But it doesn't matter how high or low you turn it. The benefits are the same. So about right there is where I'd recommend if someone isn't able to communicate to you what they prefer. Now, something that you can do if you're concerned about someone maybe getting up and walking around in a way that isn't conducive to a session with this, so you can use these magnets. These magnets I just got these on Amazon, but they're meant for like name tags. But these are pretty heavy duty magnets. And they have this little side that you can just take that off, and it has adhesive on there. You just take the back and you just put a magnet there and there. These are really strong. 2 is probably even overkill, but I usually do 2. You can use that, and then you just undo it, and you can just put this behind in the patient's shirt. And you could do it on the back too, and have the wires go behind them that way, because sometimes they may forget what they're doing and like kind of pull on them without realizing it. So that can be helpful too. They're great for people with dementia. That dementia-related agitation can be a really stressful thing, and stress is stress, anxiety is anxiety, and this can be a really helpful non-pharmacologic thing to use for your elderly patients with dementia.